Welcome, everybody. We're just going to wait a minute or so for people to join. I see our participant list growing, so thank you for joining us on this Friday. I'll say happy Friday to everyone. All right. Well, I know that folks will continue to join us, but I wanted to kick off by saying good afternoon. I am Dr. Stephen Ferrara, Executive Director of Jonas Nursing and Veterans Healthcare, housed at Columbia University, and the signature program of Jonas Philanthropies. We are excited to welcome you to our Jonas Nursing and Veterans Healthcare 15th Anniversary Scholar Celebration. In 2006, our founders, Donald and his late wife, Barbara Jonas, learned of the shortage of nurses as a crisis in our nation's healthcare system and decided to invest in the nursing profession to increase the number of nurse faculty available to teach nursing students. It is through their vision, persistence, and dedication that the program has remained consistent in supporting doctoral level nursing scholars around the country. Over the years, our program has expanded and advanced to provide over $27 million in scholarships and support more than 1,400 doctoral nursing scholars at 157 universities, representing all 50 states, including over 350 nursing scholars focused on advancing veterans healthcare. Today, it is an honor to be working with the next generation of the Jonas family, as Mr. Jonas's granddaughter, Lendry Purcell, and his son, John, are active and help provide their vision for the organization. As we close out this year, we wanted to have a special celebration to acknowledge our accomplishments over the last 15 years while also looking ahead. We intend to increase awareness of health policy and advocacy efforts affecting our profession and our patients. For example, did you know that the House of Representatives version of the Build Back Better bill has over $1 billion of funding for nursing? Be on the lookout for an email that will encourage you to contact your senator to urge them to maintain this level of funding in their version of the bill. Today, you will hear from leading nursing experts who are guiding us into the future of nursing, along with some of our scholars who have graduated and advanced their careers in nursing. We will also announce the winners of our Distinguished Faculty and Distinguished Peer Scholar Awards, and stay tuned for a big announcement about our upcoming events in 2022. Throughout the program, we will also have special prizes to give away, so look forward and check our attendee list. Listen out for your name, as you may be one of our special winners. We look forward to having a great afternoon. Now, we will have a keynote address by one of our long-standing partners for the Jonas Scholars Program, the President and Chief Executive Officer of the American Association of Colleges of Nursing, Dr. Deborah Troutman. Welcome, Dr. Troutman.
Hello, I'm Deb Troutman, President and Chief Executive Officer for the American Association of Colleges of Nursing. I am so pleased to be with you. Before I begin my remarks, I would like to take a moment for a special thank you to the Jonas family and scholars. The Jonas family has provided strong support with the establishment of the Jonas Nursing Scholars Program, a 15-year commitment to excellence in nursing and veterans health. The program was launched in 2008 to address the nursing faculty shortage. The Jonas family has supported over 1,400 scholars in all 50 states. And these scholars have increased the number of faculty, clinical teachers, and researchers in nursing. The Jonas family's commitment has strengthened not only nursing, but our ability to provide better health and healthcare to all Americans. Now, I was asked to provide a 5 to 7 minute robust keynote on the state of the art of our profession. I will do my very best. So as I think about nursing, I think it's important to reflect on our past, our present, and our future. So there are two pictures on this slide. The one on the left is a metallic plate that has the symbol of a lamp, and on the one on the right is Sisyphus. I'll speak first about the metallic plate and the lamp. As many of you know, the lamp has become recognized as the international symbol for nursing. It symbolizes the importance and the contributions our profession makes in caring, in compassion, and importantly, the lamp recognizes the light. And the light is meant to signify and symbolize knowledge, that we must continue as a profession to build our knowledge base and apply that knowledge as we care for individuals in our communities. I believe that our profession has a strong foundation in the importance of evidence to guide our practice, and that while that might have been yesterday and today, most certainly needs to continue to be our focus for tomorrow. On the other side is Sisyphus in Greek mythology, individuals charged with moving this large boulder up a hill, only to get near the top and slide down again. There are many messages that one takes away from this particular myth. I believe resilience is one of the primary. And when we think about our profession, we know that as a profession, yesterday, today, and tomorrow, we must be resilient. We must stand strong to whatever challenges come before us. And as a profession, just as we saw in the pandemic, nurses not only stand strong, they lean in and they step up as appropriate given the circumstances. I am proud to celebrate that part of our past and recognize how important it's going to be to us going forward, a part of our future. When you think about the state of nursing, what we are and what we need to be, I believe underlying all of what we are and what we need to be is the importance of leadership. Leadership at all levels in all positions. This is not leadership by title. We are all leaders. There are two quotes that are important to me when I reflect on leadership. One by John F. Kennedy that said leadership and learning are indispensable to each other. If we strive to be effective leaders, we must continue on our quest to learn more. And then this other is an African proverb. If you want to go fast, go alone. If you want to go far, go together. I would suggest to you that our future is going to challenge us to go far and fast. None of us can do that alone. We must do it together. We need to be intentional about our collaborations within and external to the profession. Now, there is a photograph on this slide of two zebras. A friend of mine is a humanitarian aid relief worker and took this photo when he was on a relaxing trip on a safari, and he calls it the zebra hug. He explained to me how this photo came to be. In the wild, when the zebras are tired, they don't oftentimes lie down, but rather rest their head on the back of another. I would suggest to you that nursing yesterday, nursing today, and nursing tomorrow, we must be intentional about how we support ourselves and how we support our colleagues. So I hope you will remember this visual and often think of how you can be the one supporting, making sure that you have support yourself and are supporting others. This next slide is to talk about our workforce. And these data points are about our workforce today. Nursing is the largest of the health professions with over 4 million nurses. I believe that is likely to continue where we will be the largest percentage of the workforce, but I think there's much about us that will continue to change. We are going to see more diversity in nursing, and we must be intentional about how we make that happen. We have seen an increase in the number of men in nursing, but we still do not yet have the level of diversity that we need in the profession to reflect and match the diversity of our population. The good news, I believe the majority of our RNs have now advanced baccalaureate or higher degrees. And I believe the complexity of care is going to continue to compel us to assure that we have baccalaureate and graduate education to meet the challenges of the ever-changing healthcare delivery system. Now, currently, the majority of RNs are employed in hospitals, about approximately 62%. I do believe we will see a change in the employment with a decreasing emphasis on acute care and a greater movement into primary care and out into the community. And it's very important, as we mentioned previously, that we must continue to advance diversity within the profession. We also must continue to support those who choose to become advanced practice nurses. And we will see an increasing opportunity for the contributions of advanced practice nurses. As many of you are aware, recently the Future of Nursing Report 2020-30 came out with many recommendations, and several that I'd like to emphasize and call out to you are the importance of nursing as a profession, doing our part to advance health equity. We must do more to improve the health and well-being of the nation. We need to work purposely to lift barriers so that we can expand the contributions of nursing. We have to strengthen nursing education so we are best prepared to meet these challenges. We need to foster our roles as leaders and advocates, and we need to remember to support our well-being and the well-being of our colleagues along the journey. We must value community and public health nursing. We need to continue to build a diverse workforce. We have to prepare ourselves to be continuously prepared to address disasters that come before us. And we do need to continue to advocate for better payment models to align incentives to recognize the values and the contributions of the nursing profession. When I think of our leadership priorities in the coming years and today, I believe we need to focus on continuing efforts to diversify the workforce. We need to recognize the issue of public misinformation. We need to recognize the importance of evidence, but that evidence alone is insufficient to compel some to agree on a shared definition of a problem, or for others to think about the evidence and what it might suggest for the particular actions to take to alleviate that particular problem or issue. Evidence is critically important. We need to continue to stimulate an interest in becoming a nurse scientist, to contributing to discovery, to contributing to the development of new evidence and knowledge. And we need to recognize that evidence alone is insufficient to compel one to action. We must be effective communicators to help others understand the course of action that we are proposing and why we believe it's important. And we must continue to build strong relationships. I believe evidence, relationships, and effective communication will enable us to make the types of changes we will need in the future. We also, as a profession, need to be more purposeful about the work that we do to address health equity and the eradication of racism. And it is both at an individual and a system level. In order for us to be as prepared as we can be, we must, in other health professions, not just nursing, we must all move to competency-based education. And underpinning, again, all of this is leadership and advocacy. In every instance, we need to think about how we strengthen our leadership and our advocacy on behalf of the profession and on behalf of better health, healthcare, and improvements in excellence in higher education. I share this slide with you that many of you are familiar with that illustrates the difference with equality and equity. And as you can see in equality, everyone has the same size box, but yet everyone cannot yet see the game. In this equity vision, there are different size boxes and one person with no box, and everyone can now see in the game. I was so pleased recently when a graduate student said to me, well, why don't we just get rid of the fence? I believe that that is what our work of the future is. How do we get rid of the fence? But we need to be intentional and purposeful about our work to advance equity. Now, I share this next quote with you because I think it's very important. John Maynard Keynes, who's an economist, this quote resonates very strongly with me, and I believe it will with many of you. The difficulty, he says, for the future lies not so much in the generation of new ideas, but rather with escaping the old ones. I believe we must challenge ourselves to escape the old ones, accept the new ideas, and continue to work towards improvements and adoptions and innovations in all that we do. Another quote that I would like to share with you, this is from Doris Kearns Goodwin, and many of you know she's an American historian. She studied presidential leadership. She talked about effective leadership. Good leadership requires you to surround yourself with people with diverse perspectives who can disagree with you without fear or retaliation. We must invite and welcome discerning voices, listening to all, and then making decisions based on the diverse perspectives. If we are going to continue our efforts to advance transformations in health, improvements in healthcare delivery, and in higher education, we must strengthen our efforts at all levels for leadership and advocacy. And I don't mean just at the federal level or governmental policy, state or local, although all very important, but equally so at an organizational level, and strengthen our commitment in our communities. In closing, I would like to share a parting thought with you from another quote. This is from John Quincy Adams. John Quincy Adams said, "If your actions inspire others to dream more, to learn more, to do more, and to become more, you are a leader." I thank you for your leadership, for your quest to be a more effective leader, and for your collective contributions to better health and healthcare for all. Thank you to the scholars, and thank you to the Jonas family.
Thank you, Dr. Troutman. That was really great and had some really important points. So good afternoon, everybody. I'm Dr. Guy Weisinger. I'm a Jonas Alumni Scholar from 2018 to 2020, and I'm currently a member of our Jonas Scholar Alumni Council. So we're going to start with our first raffle for everyone who registered for this webinar, and we're going to be raffling off a Jonas Nursing and Veterans Healthcare swag bag. So, you know, these nice canvas bags, they're great for traveling, carrying a laptop, or even used as like an overnight or beach bag. And we'll also include some little special gifts to show you how much we appreciate your support for Jonas and Nursing Veterans Healthcare. So I'm going to spin our wheel, which has everybody who registered's name on it, and we will see who is our winner. Sorry for the sound effects. So our winner is Alicia Craig Rodriguez. You're going to receive an email from us about kind of follow up on this, where we can send the bag. But we are going to have another raffle later on, so everybody stick around. And now I'm going to turn it back over to the Jonas Scholar Alumni Council members, and we'll have our Alumni Council panel. So take it away.
Thank you, Guy. Great work on the raffle there. Appreciate it. Good afternoon, everyone. My name is Dr. Margaret Riley, and I am the Academic Director for Nursing at the CUNY School of Professional Studies. I'm also a Jonas Scholar alumna from the year 2010-2012. Today, we will be hosting our Jonas Alumni Council panel discussion, and our topic for today is Leadership in Nursing, Moving into the Future. Our panelists for today will be some of our Jonas Alumni Council members, and they include Dr. Varsha Singh, Manager of the Neurosciences Stroke Program, Telestroke Specialist at St. Joseph's Health System, and a Jonas Scholar alumna from 2014-2016. Dr. Victoria Tiazzi, Director of Information Services at New York Presbyterian Hospital, and a Jonas alumni from 2018-2020. And Dr. Pamela Wall, Clinical Associate Professor at the Department of Nursing, University of New Hampshire, Jonas Scholar alumna 2010-2012. So panelists, these past 18 months have been a tumultuous time for a variety of reasons, and also highlighting gaps in the fabric of our community of care. I'm going to start with our first question to panelists, Dr. Pamela Wall, and say, having weathered the pandemic storm, what leadership skills do you see as most useful for nurses to affect needed change? We'll have Dr. Pamela Wall do the initial response and ask for our other panelists, Dr. Tiazi and Dr. Singh, to give their comments after that.
Hi, welcome everyone. Happy Friday. Thank you for your question, Margaret. So what I think is most important is engagement and advocacy, advocacy, advocacy. And think about advocacy on 3 different levels. And I think about advocacy on the microscopic level, advocating for yourself, your own practice, your fellow practitioners, your interprofessional collaborators with your patients. Then on the mesoscopic level, engaging with those state legislators, your municipal legislators on state practice acts and laws that affect health outcomes. And then on the federal level, that's the large macroscopic level. First of all, exercise your right to vote. Engage with those federal legislators on those laws, especially the one that Dr. Ferrara was talking about, that impact on federal care in a very large scale. I think with the collective voices that we have, nurses speaking as one unit, there can be a huge impact overall on our health outcomes. We have a voice and we can move forward together as one.
Thank you, Dr. Wall. Dr. Tiazi and Dr. Singh, would you care to build on those comments?
Yeah, absolutely. Thank you, Margaret. And it's a pleasure to be here. So great thoughts, Pam. I love that. There are a couple more that I would add. So I think one leadership skill that, is always important, but certainly has been, more important over these last 20 plus months, communication skills. So being able to communicate at all levels. So not just up, but down, across. So really having clear, succinct communication, I think is quite important. And then connecting to a remark that Dr. Troutman just made in her keynote, the partnership piece I have seen as extremely essential. So being able to build those partnerships outside of nursing, I think a lot of times we tend to, connect within nursing, but really, as we have seen, connecting and forming partnerships outside of nursing, even outside of healthcare. I think there's a lot that we can do there to move forward with nursing leadership.
Thank you. And Dr. Singh.
Thank you so much. I'm listening to Dr. Pam and Dr. Tiazi, and so many thoughts in my head. First of all, I want to say hello to all the JONAS scholars, and thank you for giving me the opportunity to say a few words on this beautiful day while we are celebrating years of JONAS scholarship and JONAS scholars. So leadership in my eyes is daring to do something wise. Having courage and strength. So that's how I started. Many of you know, and Dr. Ferrara knows, I'm from India. I came to this country only in 1998. In past 20 years, all I had to do was ask. So I give a lot of credit and importance to mentorship. Don't be afraid to ask for help. And this is for those nurses who are starting their career, who are new, and they are looking around, looking up to all the nursing leaders. So as Dr. Pam said, do microscopically up to macroscopically, and Dr. Tiazi said communication skill. If you put it all together, look around where you are. You have an idea, don't be afraid. Talk to your nurse leaders within the hospital system, within the community, at the state nursing organization, and find all those people who are going to lift you up. It's all about equality, equal opportunity, understanding what your colleagues are, no matter from which background they come from. I have experienced it in my 20 years of as a nursing student and as a nursing leader, as well as a nurse clinician, that when I reach out, I will always find someone to support me. And that's how collectively we can grow together as one voice. And that's the secret, in my opinion. Thank you.
Some very wise words. Thank you for that. Partnerships, collaboration, asking for help and mentorship and advocacy, all great points that you made. Thank you, panelists, for that. For our next question, we're going to start with Dr. Tiazi. Since the topic of advocacy was brought up, we want to ask, since it is such an inherent part of nursing, in light of the renewed spotlight on diversity, equity, and inclusion, how can nurse leaders advocate to promote these values in their practice?
Great, thanks, Margaret. And I think this is going to be, connected to a lot of Pam's great comments earlier on advocacy. But I think, the important piece for me, thinking about the spotlight on diversity, equity, inclusion, is that a lot of times we hear it in the context of our patients, which is, absolutely and certainly important that we are taking that into account, bringing social determinants of health data and using that to influence our practice. I think we also need to understand that it's our patients and it's our staff, right? So it's both. So it's really thinking about placing the emphasis on both of those areas. For me, in order to get that advocacy started, there are a couple of things that I think about as a nurse leader. So one is active listening. So I think it's really important, again, as nurses, we do an amazing job listening to our patients and families, but I think it's also listening to each other, right? So sitting down with our staff or our colleagues and really getting to understand and bring awareness to where the gaps are and where some of the opportunities are. So really carving time out for those listening sessions. And then the second point I'll make around the staffing piece is, again, that idea of connecting to other partners in the organization. So looking at your HR partners, so having active dialogue with them to ensure that we have a staff that reflects our patient population and strategizing ways to do that. So I think those are, important pieces as we then move forward to bring our voice to those larger advocacy efforts.
Thank you, Dr. Tiazi. Excellent points. I want to circle back to Dr. Wall, who started our conversation focusing on advocacy. I'm sure she has more to say on the topic.
So I'm an educator at heart. And so I think of how can we advocate through education? And I think about something that really impacts on health outcomes, and that's implicit bias and stereotype, and how can we mitigate that? And so I think about provider bias and those negative implications, and how can we impact that? What kind of opportunities can we have as providers in educating our staff on implicit bias? I think that incorporating training on implicit bias as a community, as a partnership, we can take those first steps in acknowledging those influences of our own personal backgrounds and our experiences, and how they can filter our lens for good or for opportunities for improvement, and take those beginning steps to mitigate those possible implicit biases in the healthcare arena, and really help to contribute to more improved patient outcomes.
Thank you, Dr. Wall. Dr. Singh, do you have any other last words to add on this? Absolutely. I know we could talk about this for probably hours. We have a short time and we want to hit on the key points. So what can you add to this discussion?
And this is something that I will add from my personal experience, that a nurse's success is based on how she or he communicates with the community. I have done extensive partnership with community for past 15 years. it has been nothing but a reward. It's almost like you understand what they need and then you provide the service to them. So that partnership is very valuable. Thank you.
Great comments, and a lot more, obviously, that we could talk about and think about in regards to that subject. But being that we have such a short span of time, we're going to move on to our final question. And this is a question related to the caring aspect of nursing. And as we saw these past few months, caring, even more so, is the heart of nursing. And yet it's something that's often overlooked by nurses for themselves. What recommendations can you make to address the stresses leading to nurse burnout and compassion fatigue that we are seeing ever more so in these days post-pandemic? And Dr. Singh, we'll start with you.
Thank you so much. When I see that nurses are burning out, but we all have to remember that we are also looked at someone that will care for the patient. So they are looking at us to provide the compassionate and equally competent care to our patients. They are looking at us as an experts. Burning out has been a phenomenon since COVID started. We know that pandemic has taken a toll on us. However, it takes a lot of strength on our part to take a step back, pause, and think who we are first. We are providers. We are healthcare providers. And then second thought is, I need help as well. So what am I going to do to care for myself? These are two important and significant questions that we need to ask, not just in that moment of stress, but once we are at ease and sitting and having a thinking process. So organizations, our professional organizations such as Jonas or nursing organizations which are state-based, they have a lot of resources that help nurses with their self-care. And I think this needs to be promoted at every level. Just like Dr. Wall said, microscopically, personally, I'm going to take care of myself so that I can take better care of someone else. Starts with that. Look around if your nurses, your colleagues are burnt out. Take time to ask them, how are you doing? And then reach out to your leaders in the organization and say, hey, what can we do about our nurses? Talk to your state president, ask them, are we doing anything for our nurses? And then make that voice, a single voice says, hey, we really need to care for our nurses and we need to do things so that they can work better and our population can receive better care.
Starts with small steps, as you point out. Thank you for that. Dr. Wall and Dr. Tiazi, can you help us wrap up these concluding remarks in response to caring and caring for ourselves? Dr. Wall, there you go.
Sure. So I'm going to start with a phrase. It's curate ipsum, and it is physician heal thyself. And we're going to extrapolate that to nurses. There's this wise old soul by the name of Hippocrates, and this is found in religious references as well. What does this mean? It means that this has been around for a millennia or several of them. And this is not just a pandemic. This is something that is being told to us for thousands of years. I think it's a really good, strong indication that some really good, solid, evidence-based recommendations for us to take care of ourselves. So acknowledging this and doing the things that Dr. Singh is telling us to do is really important first steps for us to take care of ourselves and then take care of our patients.
Thank you,
Great,
Dr. Tiazi. Go ahead.
Yeah, I'll just take that in a slightly different direction. So I will say, in addition, all of the great work that's been surfacing over the past 20 plus months in thinking about the systemic changes that need to be made that can support nurses with burnout and fatigue. And I would recommend we keep doing that. So keep connecting with each other, keep using your voices to call out those things that are in need of further examination or radical change. And then as nurse leaders and nurse scientists, look to study those interventions and find the best ways to support our nurses moving forward. Thank you.
Well, thank you all for a wonderful discussion, for your insights and your perspectives. Much appreciated. We hope that our audience could have some good takeaways from it. Thank you again. And we will now be turning this over to our Jonas Alumni Council member, Dr. Catherine Mackey.
Thank you.
Good afternoon, everybody. In honor of celebrating 15 years of the Jonas Nursing and Veterans Healthcare Program, this year we would like to honor a few Jonas Scholar alumni and a Jonas Scholar faculty advisor who have contributed to the nursing profession through their leadership and dedication to nursing. My name is Catherine Mackey, and I am a current postdoctoral fellow in the Translational Biobehavioral and Health Disparities branch at the National Institutes of Health Clinical Center. I'm honored to first acknowledge our Jonas Nursing and Veterans Healthcare Distinguished Peer Award winners. This award is granted to select scholars who have been nominated by their peers and have been proven to exemplify the high standards and expectations of a Jonas Scholar alumni. Our first award winner is Dr. Karen Alexander, an assistant research scientist at the Friends Research Institute. Dr. Alexander is a Jonas Scholar alumni from the 2016 to 2018 cohort. And Dr. Alexander has been selected for her extensive research in women with opioid use disorder, focusing on their physical and mental health needs. Her leadership on several projects during her role as an assistant professor at the Thomas Jefferson University College of Nursing included curriculum development, and she studied as served as a chairperson of the Student Promotion Committee and the COVID-19 Steering Committee. Congratulations, Dr. Alexander, on receiving the 2021 Jonas Nursing and Veterans Healthcare Distinguished Peer Award. And now we'll hear a few words from Dr. Alexander.
Thank you for the Jonas Scholars Distinguished Peer Award. I'm Karen Alexander, and I'm a proud alumnus of the Jonas Nurse Scholars Program at Duquesne University, where I received my PhD in nursing in 2018. The Jonas program enabled me to become a nurse scientist working to improve healthcare delivery for people with opioid use disorder. The program also provided many of the necessary professional skills that I need to work as an interdisciplinary scientist in research. I also thank my mentors at Duquesne University, Dr. Sakula and Dr. Cronk, and my colleagues at Jefferson College of Nursing who also support me in my professional development. Thank you.
Our next award winner is Dr. Tamaya Nolan, an assistant professor in the College of Nursing at The Ohio State University. Dr. Nolan is a Jonas Scholar alumna from the 2014 to 2016 cohort. Dr. Nolan has been selected for this award due to her dedication to research in health disparities and health equity among African American breast cancer survivors. Her noteworthy leadership activities include building community and government partnerships to improve the healthcare for underserved communities, and also providing mentorship to numerous faculty and students as an assistant professor at the Ohio State University College of Nursing. Congratulations, Dr. Nolan, on receiving the 2021 Jonas Nursing and Veterans Healthcare Distinguished Peer Award. And now we'll hear a few words from Dr. Nolan.
Hello, I am Tamaya Nolan. I'm an assistant professor and nurse scientist at The Ohio State University College of Nursing and Comprehensive Cancer Center. I am so honored to receive the Jonas Nursing and Veterans Healthcare Distinguished Peer Award. First, I want to say thank you to my illustrious colleague Karen Moss and Dean Bernadette Melnick for the nomination. And I also want to thank Jonas Philanthropies for supporting my doctoral education. As a nurse scientist, I'm seeking to create healthier communities and in doing so, move the needle toward health equity. And much of the work that I'm doing now has flourished from principles that I learned while a 2014-2015 Jonas Scholar. I'm centering on patients and building academic, community, and government partnerships to educate and empower. So I thank you for this illustrious and wonderful award.
Our third award winner is Dr. Kelly Ringa, who is an assistant professor at the Indiana School of Nursing. Dr. Ringa is a Jonas Scholar alumna from the 2012 to 2014 cohort. Dr. Ringa has been selected for her efforts to support and uplift her peers and colleagues in the nursing profession through substantial mentorship and career guidance. Her noteworthy leadership activities include developing and committing to national programs that provide mentorship and education to nurses in the early stages of their career. Congratulations, Dr. Ringa, on receiving the 2021 Jonas Nursing and Veterans Healthcare Distinguished Peer Award. And now we'll hear a few words from Dr. Ringa.
Hi, my name is Dr. Kelly Wieringa, and I'm so grateful to be receiving this award. My time as a Jonas Scholar really fueled my passion toward diversity and inclusion in research and peer mentorship in nursing. I continue to develop systems of peer mentorship as a trainee and now as faculty, and that really makes this nomination and the receipt of this award so touching. I'm grateful to be a part of the Jonas Nursing and Veterans Healthcare community, and I thank you for recognizing me for this distinguished peer award.
Our final award recipient today is the winner of our Jonas Nursing and Veterans Healthcare Distinguished Faculty Award. This award is granted to select faculty who have been nominated by Jonas Scholars and exemplify truly extraordinary selflessness as they support and contribute to the research, career development, and advancement of Jonas Nursing and Veteran Healthcare Scholars. This award goes to Dr. Rita Douse, the Associate Dean for Teaching and Learning at the Johns Hopkins School of Nursing. Dr. Douse has been selected for this award due to her longstanding commitment to encouraging and mentoring Jonas Scholars and supporting their career paths even after graduation. Her contributions to nursing research also include developing and uplifting the nursing workforce through her work with mental health. Congratulations, Dr. Douse, on receiving the 2021 Jonas Nursing and Veterans Healthcare Distinguished Faculty Award. And now we'll have a few words from Dr. Douse.
Hello, I'm Dr. Rita Doust. I am honored and grateful to be the recipient of the Distinguished Jonas Nursing and Veterans Healthcare Faculty Award. The Jonas Philanthropies have made a significant impact through the Jonas Nursing and Veterans Healthcare programs to improve the health of veterans by supporting doctoral level nursing candidates who are committed to advancing veteran healthcare and supporting nurses who will address our nation's most pressing healthcare needs. I thank Johns Hopkins School of Nursing and Dr. Trish Davidson, and especially my Jonas Scholars who have nominated me for this award. They inspire me, and it's been a privilege to serve as a faculty mentor for Jonas Scholars since 2013. There is a misperception that all veterans receive care in the VA. Prior to the Mission Act of 2018, upwards of 75% of veterans were receiving their care in the civilian sector, and we know that that percentage has increased since the passage of the legislation. So, if you care for patients, you will care for veterans and their family members, and who are most likely providers are unaware of their military affiliation. Thank you, Jonas Nursing and Veteran Healthcare, for investing in nursing and our veterans. I thank you once again for this award.
We are extremely proud of the accomplishments of all of our honorees. If there is a Jonas Scholar or faculty advisor who you believe deserves special recognition for their work in nursing, we encourage you to keep an eye on your emails for the spring announcement for submitting nominations for our 2022 awards. Thank you.
I just want to, say congratulations to all of our amazing award winners. You did excellent work throughout your careers, and every single one of you deserves to be recognized. We're going to have another quick raffle for everyone who came today, and we're giving away another one of our Jonas Nursing and Veterans Healthcare swag bags to the people who came today. So I'm just going to do a spin of our wheel, and we'll see. Emily McClure, congratulations. We will email you about getting a mailing address, but congratulations. And now I'm going to hand it over to Dr. Althea Hicks, who's going to have some kind of closing remarks. But thank you all so much for coming, and we really have appreciated you all being here and recognizing these amazing awardees and hearing from our Alumni Council.
Good afternoon, everyone, and it's great to see you all again. Again, congratulations to all of our award winners. As you know, I'm Dr. Althea Hicks, Grants and Programs Manager for Jonas Nursing and Veterans Healthcare. At this time, we would like to thank all of our partners who have been supporters and who have donated to our Jonas Nursing and Veterans Healthcare program over the last 15 years. Your contributions and donations have actually allowed us to continue our Jonas Scholar program and support further development and advancement of the nursing profession. We deeply appreciate and value your support. And so at this time, if you would like to become a donor or if you would like to actually support our program, please visit our website at www.jonasphilanthropies.org and click donate. And now for our big announcement. So over and over, we have heard from our scholars, current and alumni, that the programs and activities that they have found most helpful are those that allow them to meet, engage, and network with other scholars. Well, you've asked, so here we are. In 2022, pending the Center for Disease Control guidelines allow, we would like to invite all of our Jonas scholars, past and current, to join us at our upcoming networking receptions. The first one will be held in February in New Orleans at the Southern Nursing Research Society Conference. And so please keep an eye out for your emails for further details and registration information. Next, for each cohort, we host the Jonas Scholar Leadership Conference. And this is where our cohort scholars, the current scholars, get to meet and engage and network with each other. They also hear from leading experts in the field of nursing. The conference is so exciting, and the scholars have often asked, can they come back or can they do this again? Can we have another conference? So for the first time in Jonas Nursing and Veterans Healthcare history, we are going to invite all of our scholars to join us at our Jonas Nursing and Veterans Healthcare Leadership Conference, which will be held in Washington, D.C. in October 2022. Given the number of scholars that we have, you've heard it time and time again, over 1,500 scholars we've supported over the years, limited seats are available. So registration will be on a first come, first served basis. So please keep an eye out on your emails for more details. And at this time, we'd like to thank all of you who were able to join us today for our Jonas Nursing and Veterans Healthcare 15th Anniversary Scholar Celebration. We thank you all for joining us. All congratulations to all of our award winners. And we wish you all a safe and healthy and joyous happy holiday and a happy new year. Have a wonderful day, everyone.